Hi folks, welcome to Chapter 16, Science, Technology, and Global Health. We just talked about the importance of collaboration as it relates to global health, and now we want to talk about trends in science and technology and how they can have and are having an impact on global health. My name is Dr. Jody Sutherland, and I'll be providing you with an overview of the chapter. As always, remember to review your objectives, as these will help you to better understand the material and also prepare for your examination. So when we think about science and technology, we can think about the advances of public health during the 20th century, and a lot of those were technological advancements as well as medical advances that again have contributed to better quality of life, increased life expectancy, and reduced disability as a consequence of disease and other factors. So science and technology can have and have the potential to make major contributions to the development of diagnostics to address or detect certain diseases, vaccinations, drugs to treat certain diseases, and medical devices that can help address some of the highest burdens of disease, particularly as it relates to those in the low and middle income countries. Needed technological advances are unlikely to come about on their own, so we're going to have some resources and infrastructure to be able to promote the development of technological advances. Historically, the for-profit sector has been a major developer of these diagnostics and vaccinations and drugs. So they played a key role. But the for-profit sector really doesn't believe that the market for these products in the developing world is sufficient to give it an adequate return on its investment. So we can see we're trying to address these shortcomings. So the for-profit sector needs to make money, and so they're afraid that they're not going to see the return on their investment if they try to again address some of these contributing factors to the burden of disease in the developing world. And so we see that there's some lag in the development of science and technology, again, to address common factors that lead to reduced life expectancy and greater disability in low and middle income countries, because again, the market's not there. So these factors constrain the for-profit sector wanting to invest a large amount of money into what they're doing. So that's where these partnerships, again, are so important, to try to offset the need for profit. When you get a public and private partnership, these private foundations, for example, can contribute funds into the development of these advances, and again, offset the need for it just to be about profit. So when we think about the need for new products, why is there this need? So when we think about characteristics of new technologies, they need to reflect the following attributes, if you will. They need to have in mind that the most important target groups are poor people. So how can we create products that can have an impact among those of the lowest socioeconomic status and oftentimes the most vulnerable to these burden of diseases? Quality of care as well as injection safety is often low, so these are things that we need to consider. And also, many low and middle income countries have poorly organized health systems. So what products we create, how can we then introduce them within a health system that may be struggling or may not be well organized and have little infrastructure to support the technologies that we are developing. When we think about some of these new products, we have to think about the diagnostics of these products. We want them to be inexpensive, obviously, because we're going to introduce them into low and middle income communities, easy to use, as well as non-invasive. Again, because there's not the health system's infrastructure. When we think about drugs, they also need to be safe, have been well tested, and understand the ramifications and some of the side effects. Again, inexpensive, and we can think of antiretroviral drugs and how at one time they were so expensive that South Africans were unable to access these antiretroviral drugs. This has been several years ago, and that gave rise to an advocacy group called the Treatment Action Campaign to try to advocate for South Africa, which at that time had the highest prevalence of HIV/AIDS cases in the world, to access generic forms, more affordable forms of these drugs to treat HIV. These drugs need to be able to be used for many years without becoming susceptible to resistance. And there's so much discussion about different strains of viruses and things and bacteria that are resistant to certain medications. Also, with our vaccines, they also need to be effective, inexpensive, and require only one dose to confer lifelong immunity. Again, access to these peoples may be difficult, so we don't want to have something where we have to inject the individual in 3 months and then inject them again a year later. Ideally, when we think about these products, they would also need to be easily transportable, heat stable, and not require refrigeration. Again, because we're going into some of the most vulnerable communities where they don't have adequate resources. Now, when we think about what's the gaps currently in our technology, the effectiveness of TB vaccinations are limited. Drugs for TB, malaria, and HIV are highly susceptible to resistance, particularly if the medications are not used appropriately. There are no vaccinations currently for HIV, malaria, and then when we think about the HIV drugs that are available, they can help control symptoms but not cure the infection. So again, that's important to remember, and areas where it would be important to research and provide new products. Next, you'll look at the potential of science and technology, how they can impact the genome of pathogens, and this could help improve the development of vaccines and drugs, and also reduce resistance, again, that we are seeing, particularly as it relates to HIV medications. Hopefully we'll see as well improvements in technology that will help facilitate the development of new drugs. So that's an important area where science and technology can meet and continue to create. And then when we think about genetic modification of plants, and this can help lead to more nutritious and disease-resistant crops, although it's not always welcome, but still this is a potential area where we could capitalize on. And when we think about, again, the types of drugs that have been developed, only a small number of the drugs that have been developed over the past 20 years have been developed to address, again, the main burdens of disease among the poor and low and middle income countries. When we think about what's marketed here in the United States, it's generally cosmetic in nature, lots of cosmetic drugs to enhance our beauty, to enhance our functioning, whether that be to control bladder or what have you. But again, if we could incentivize the creation of these new products that would, again, address the main burdens of disease in the low and middle income countries, we could really make a huge impact, particularly as it relates to the Millennium Development Goals and reducing some of these gaps and disparities that we're seeing. So we see the potential, but what are some of the constraints? Again, we've already talked about this, but the for-profit sector doesn't believe it could make a sufficient profit, again, from products for low and middle income countries. Again, when you have such a disparity of income and wealth, these for-profit companies are going to invest a lot of money into research and development, yet the returns are going to be low for them, and so they need to make a profit. So there's no incentive. So that's obviously finances is one of our main barriers. Again, costs of research and development on new products are very high, and the majority of companies spend the majority of their income on research development as well as marketing these products. And then the number of firms that are actually engaged in vaccine production are very small. So we need more individuals getting involved in this area. So we can look here at these push-pull mechanisms for product development. So this could be a means of reducing the risk of developing new products enough that these for-profit sectors might be interested. So how can we incentivize this for them? And so this section will talk about push and pull mechanisms. When we think about overcoming market failures as well as encouraging the development of these desired products that will address, again, the highest burden of disease in these low and middle income countries, it's going to require a series of measures. So we can think about these from the standpoint of push mechanisms, and these encourage product development by reducing the risk and the cost of investment. That might be through direct financing through other entities or tax credits for those who do research and development. So those are just a couple of ways that can do that to incentivize product development among the private sector. And then we have pull mechanisms, and these ensure that a future return will be available for these for-profit sector organizations in the event that a product is actually produced. So, for example, there might be transferable patents, or more specifically, increasing vaccine uptake. So if there was a vaccination that was available, helping to increase its uptake in these low and middle income countries, so again that a profit could be ensured. And then we can look here at how, again, this is looking at enhancing new product development, again, focusing on these push and pull mechanisms. Again, you'll want to read a little more specifically about that. And then here, you'll want to highlight some of the information that's given here in the policy and program brief. And we can see that, for example, considerable hope for this development of new products is being placed in this public-private partnerships, again, increasing access to financing to incentivize the private sector's development of products that will address the common burden of diseases in these low and middle income countries. And some of these are the International AIDS Vaccine Initiative, the Global Alliance for TB Drug Development, and Medicines for Malaria Venture. And these are, again, these public-private partnerships have been created to overcome these limitations to the private sector where they need to make a profit. And as you conclude reading this chapter, make sure that you review the study questions, as these will help reinforce the material and also study for the exam. Have a great day.